now exceeds the total number of infections across the globe. According to the latest update from the University of Oxford's Our World in Data and the U.S. Centers for Disease Control and Prevention, 104.9 million vaccine doses have been administered globally. This exceeds the 104.3 million confirmed cases of COVID-19. Israel leads the world, having administered enough vaccine doses for 28% of its population. Health officials around the world are racing to vaccinate even more people in the face of new and more infectious COVID-19 variants. The World Health Organization also underscoring the importance of equal vaccine distribution among nations.
Because much in all, as we've had a huge economic impact in developed countries, many of these developed countries can take that. They will recover. But some developing countries were already in trouble. They're already far behind, and they're going to fall further behind. And we can't afford to let that happen. If we want our societies open, if we want to be on the journey to normalization and normalizing the way we live, then we've got to be fair about how we distribute the means to live normally. And right now, the unequal distribution of vaccines means that not all societies are going to get an equal chance to come back online. And that's simply not fair.
COVAX allocates at least 330 million COVID-19 vaccine doses for poor countries. That's according to the Vaccine Sharing Facility's interim distribution plan, which would cover an average of 3.3% of the total populations of 145 countries. The allocation includes vaccines from AstraZeneca and Pfizer. COVAX says they aim to deliver these in the first half of this year.
There was a delay to the expected timeline for the candidates securing WHO emergency use listing, which means that some shipments will be moved into the third quarter. And we hope that you agree that today is a positive day as we think about this equity agenda that we've been talking about for a long now, less than 2 months since the first mass vaccination in a non-clinical setting anywhere in the world. At this point soon, we'll be able to start delivering life-saving vaccines globally, an outcome we know is essential if we're to have any chance of being able to beat this pandemic, as well as deal with the new scientific challenges, such as the new variants.
The World Health Organization blocked COVAX, or Make That Backed COVAX, was launched last year with a goal of ensuring equitable access to vaccines during the pandemic. It aims to deliver a total of 1.8 billion doses to lower-income countries by the year end at no cost to their government.